The movie begins in a hospital, where we see a group of doctors trying to resuscitate a newborn baby. The mother, Diane, is called to see the condition of her child. Seeing her baby lying motionless inside an incubator, she asks if the baby is okay. In what appears to be a mother's support group, a woman is softly crying, asking who's going to take care of her child when she gets to college. When she's done talking, the group wants to hear from Diane. Although she's uninterested, as she's on her phone during the meeting, she tells everyone that for 17 years, she has abandoned her personal life, dating and traveling the world, so she can take care of her daughter, Chloe, because of her challenges, and she's been brave about it. Chloe wakes up at exactly 6:45 a.m. and gets in her wheelchair. After throwing up in the toilet, she goes to apply cream to some of the rashes on her skin. Next, she takes her medication for the day and proceeds to go downstairs with the help of a lift. Downstairs, Diane is preparing breakfast. She pricks Chloe's finger to check her insulin level and finds that the level is at an all-time high. Before Diane can inject Chloe with an insulin shot, Chloe takes the needle and does it herself. Afterwards, Diane helps Chloe with her cyclical therapy and schoolwork. In the afternoon, Chloe takes more pills when the mailman comes in. Chloe runs to check, but Diane has already gotten the letters. After noticing that Chloe is short of breath, Diane asks if she has used her inhaler, but Chloe says she's fine. Diane promises Chloe that if any college letter comes, she will immediately show it to her and tells her to focus on her studies for now. Diane tends to her garden, harvesting some tomatoes, which she cooks for dinner. After checking Chloe's insulin again, Diane finds that they are low, so she gives Chloe a piece of chocolate. Later, Chloe is seen watching videos online about the University of Washington, clearly excited to go there, that she doesn't respond to Diane when she asked her some questions. Chloe is working on a 3D printer when she gets frustrated that some functions refuse to work. Diane comes to ask what's wrong, and Chloe tells her that if she had a phone, she would have known. Diane encourages her, saying she can figure it out, before giving her the last medication for the day. Afterward, Diane goes down to the basement to watch a video of Chloe when she was still a child. The next morning, Chloe sees her mom in front of the house unpacking groceries from the car. She stares through the window, longing to go outside. When Diane gets a call and leaves to find better reception, Chloe checks out the grocery bag her mother brought and steals a few chocolates. While checking the groceries, she finds a bottle of pills prescribed for her mother. Hearing her mother approaching, she immediately puts the pill bottle back inside the grocery bag. Diane states that her old medication company went out of business and she had to switch prescriptions. Chloe reluctantly asks if the pills are hers since she saw her name on the pill bottle earlier, to which Diane scoffs and tells her it was only a label. The next morning, Chloe skips taking her pills and crafts a mechanical claw, which she uses to reach the pill bottle on the top shelf. A car can be heard approaching. It turns out it's the mailman again, and Chloe hurries to get the mail, only to find Diane got to it first. When alone, Chloe investigates the pills and sees that the name is trioxin. When she examines the container further, she finds her name on the label. She decides to peel it off, only to find her mother's name underneath and realizes she's been given unnecessary medicine. Later, when her mother gives Chloe the pills for the night, she secretly spits them out. When she's sure her mother is fast asleep, Chloe goes on the computer to continue her research on trioxin. Unfortunately, there's no internet connection. While in the distance, Diane is seen watching Chloe, and she doesn't notice. In the morning, Diane is seen arguing with an internet provider. It appears that their internet is down until further notice. Diane asks Chloe about her internet use last night, and Chloe lies, saying she's been Googling how to fix her 3D printer. Every time her mother is distracted, Chloe seeks to learn more about the pills. She tries to call a pharmacy, but they quickly hang up on her, mistaking her voice for Diane's. After multiple unsuccessful attempts to connect to a pharmacy, Chloe calls a random number, and a man picks up. She pleads with him to help her by researching trioxin pills. After some persuasion, the man agrees, and Chloe soon finds out that trioxin is a drug used for heart disease and can cause heart failure. After finding out the colors of the pills don't match, the trioxin being red and the pills she's been taking being green, Chloe is confused and doesn't know what to do next. The next day, Chloe and her mom go to a theater to watch a movie. Chloe excuses herself to go to the bathroom. Instead, she goes outside and crosses the road to get to a pharmacy. She cuts through the waiting line and shows the pill to a pharmacist, asking what kind it is. The pharmacist refuses to answer at first, but when Chloe lies that she and her mom are playing a scavenger hunt and the next clue is the pill name, the pharmacist informs her that the pill is a muscle relaxant for the leg and that it's made for dogs. Chloe has a panic attack, and at that moment, Diane enters the pharmacy and injects her with an insulin shot. Diane takes Chloe home and takes a shower, revealing deep scars on her back that appear to be from slashing or claw marks. Later, Diane has a phone call where she tries to convince the pharmacist that she would never give her daughter pills meant for animals and Googles household neurotoxins. Chloe wakes up in her room and finds the door locked. Her mother appears to not be at home, and she takes the opportunity to try to escape. She manages to pick the lock, thanks to her study guide, but there's a rake outside the door that keeps it shut. Chloe decides to tie a bunch of electrical cords together, fills her mouth with water, and takes a soldering iron with her. She climbs out of her room window with a blanket. When she gets to the other side of the house, she plugs in the soldering iron and places it on the glass, cracking it. She pours the water from her mouth onto the glass, hastening the shattering process. She places the blanket on the window to prevent getting cuts from the shattered glass. Chloe can't breathe and has to go back to her room to get her inhaler. After she does so, she hurries to her lift, but it turns out Diane has already cut the wires. She throws herself down the stairs and suffers some injuries. While wounded, she discovers she can move her toes since she hasn't been taking the pills for days now. Chloe gets in her wheelchair and tries to escape but accidentally rolls in front of a truck. Thankfully, the truck stops before it can reach her, and the driver worryingly approaches Chloe. At the same time, Diane arrives, and they have an argument because the driver is suspicious of Diane. The man asks Chloe whether they should go to the police or the hospital, and Chloe says to the police. Unfortunately, before they can go, Diane subdues the man by injecting him with an insulin shot, which causes Chloe to hyperventilate and pass out. Chloe wakes up in the basement, where she finds her college letters trashed. She also discovers her baby photos, where she's seen walking, despite her mom telling her she was born crippled. Chloe finds the death certificate for a baby named Chloe, which states she lived for only a little over 2 hours. A newspaper clipping mentions the case of a baby stolen from a hospital, indicating Diane stole Chloe as a baby to replace her dead child. A flashback is shown in which Diane is holding her dead child and screams, later staring at the newborns in the nursery, waiting for the nurses to leave. Chloe breaks down upon her realization. At that moment, Diane walks into the room, and the two have a heated argument. Chloe asks Diane if she was ever truly sick, to which Diane breaks down crying, trying to persuade Chloe that everything she's done was for her own good. Diane begs Chloe for both of them to go back to their lives as before, to which Chloe refuses. Out of desperation, Diane takes out a syringe and draws a harmful substance. Seeing that Diane is trying to poison her, Chloe hurries to the closet and locks herself in. Diane pleads for Chloe to open the door, but Chloe doesn't respond. When Diane breaks down the door, she sees Chloe holding a bottle that, if swallowed in large quantities, causes death. Chloe yells out that Diane needs her and swallows a handful of pills. Diane screams and tries to stop Chloe, but it's already too late. She's forced to take Chloe to the hospital, where Chloe is saved. Outside the hospital room, Diane urges the doctors for her daughter to continue the treatment at home, but they refuse. Inside the hospital room, Chloe tries to get the attention of the nurse taking care of her, but her hands appear to be paralyzed. She tries to write something on a sheet of paper, but an emergency makes the nurse leave before she can show what Chloe wrote. Diane uses this opportunity to abduct Chloe. In the elevator, she promises that she will never hurt Chloe again. The nurse finds out that Chloe has been abducted. Meanwhile, Diane tries to get Chloe down the escalator stairs herself because they're not functioning. She's unsuccessful because Chloe is using her legs to stop her. They have an argument, and Diane pulls out her gun. Before she can use it, she's shot by a police officer and falls down the escalator stairs. 7 years later, Chloe is seen driving her car to visit her mother. It appears that her legs are better, but she still needs to use her wheelchair and a walking stick. She meets up with a clearly sick Diane and spits out 3 trioxin pills as Diane's heartbeat quickens. Chloe says it's time to go home, indicating that she will take care of Diane the same way Diane took care of her. Thanks for watching. If you enjoyed the video and would love to see more from this channel, please like and subscribe.